Yeah, pleasant good afternoon to everyone. Thanks for coming out on Sunday when I know it's your home time and family time. I would also like to thank Nurse Blois for inviting me to come and talk on a topic that's very close to my heart. It's about heart attacks. Lately we've been seeing a lot of young people in their 30s and 40s with heart attacks. It's not something I was seeing before. So this is a new trend which we need to nip in the bud. Otherwise, we're going to have a lot of young people falling down dead from heart attacks. This may be the first generation in which the parents will be burying their children. So it's something that's very serious that we have to come to terms with. So this afternoon, we're going to divide the topic into several categories. First, we're going to talk about what is heart attack. How common is it? What's the cause? How does it develop? What's the end result? What are the clinical features? Meaning, what is it the patient complain of to make you think the patient is having a heart attack? What is it we find when we examine the patient? What is the signs? What investigations we do to confirm that the patient is having a heart attack? How do we make the diagnosis based on what the patient's complaining of? What we find when we examine the patient? And what the investigations reveal to us, like an EKG, blood test. What's the prognosis? If you have a heart attack, that means you're going in, that's it. Or there are different spectrums of prognosis. How do we treat a heart attack? What are the complications? Because one thing to get a heart attack, we have to always worry about complications. And last and most important for us is how do we prevent it? Right? So without further ado, what is a heart attack? Just feel free. Let's have a conversation because once we interact, we better remember more and will jog my memory. Okay, perfect. So what attacks the heart? Who attacks the heart? How does the body attack the heart? How has the heart become the enemy that it has to be attacked? Right, so that's one of the causes. So it's the hypertension that attacks the heart. How does the high blood pressure attack the heart? Okay. Pressure high. What else? Anything else? High cholesterol. Okay, so we're talking about risk factors in the what we call this pathogenesis. So what's the medical term for heart attack? What myocardial infarction. So myocardial is the medical term. Infarction is when you have death of the heart muscle. Right? So myo is muscle, cardium heart, infarction is death. So something caused the heart muscles to die. And what causes the heart muscle to die? Lack of blood supply. Right? So basically a heart attack is when the blood supply gets shut off. That's where the attack occurs, at the level of the blood supply. You ever heard of the word stroke? So we can call a stroke a brain attack. And we can call gangrene a foot attack. Right? And erectile dysfunction, penis attack, penile attack. So it's when the circulation gets attacked. It gets attacked when it becomes blocked. Right? Embolism can happen for strokes, but with the heart it's rare. It's usually, as we go on, we'll look at the mechanism. But you just got to get the definition straight. So a heart attack is a myocardial infarction. Myo is muscle, cardiac is heart, infarction is so death of the heart muscle, and it's usually due to blockage of the blood supply. How common it is? It depends on the risk factors in the community. Before we used to see it in the elderly, 60s and 70s. And when I went through medical school, I thought it's random. You probably have bad luck. As you get older, you know age is the number one risk factor for heart attack. And unfortunately, if your family had it, or you had diabetes, or you have high blood pressure, it's not a question of if, it's when. You live long enough, everybody the elderly, but we're seeing it in much younger group age groups, like late 30s, 40s, because of risk factors for developing the blockage of the arteries to the heart. We're seeing young people now with hypertension, seeing young people now with diabetes, seeing young people now with abnormal cholesterol, seeing young people now with obesity. Some young people not exercising enough. The stress. Stress is increasing for all age groups, and that can contribute to heart attack. Okay? So what are the causes? We started to mention some of these. High blood pressure is one. Diabetes is another one. Smoking is another one. Obesity is another one. Not exercising enough is another one. Not getting enough sleep is another one. They told me in medical school sleep was just a concept. But sleep is where your body kind of regulates your stress, recover, and so on. It's important. High bad cholesterol and low good cholesterol. Right? Age, as you get older, the wear and tear increases, and so on. And gender. Women are protected from the estrogens and men. And once they go through menopause, the risk is about the same. So what's the connection with all these risk factors? How does hypertension, diabetes, obesity, abnormal cholesterol, smoking, stress cause blockage of the artery? Because it's hardening of the artery. So basically, it comes down to the plumbing through the heart, the integrity of plumbing life that prevents freedom of circulation flow. And as a result, when that happens, the whole system loses the integrity and it gets blocked and the heart muscles die. Okay? So the process in medical terms is called atherosclerosis, hardening of the artery. When the pressure is high, you put in more strain on the arteries, you get wear and tear, rupture of the small vessels, and then the cholesterol in it leak out and go on to the lining. And we call this a fatty streak. And develop a plaque, and then it builds up. The more pressure it is, the more leakage, the more buildup. And then it's like a little pimple on the inside of your artery. And the more diabetes, the more hypertension, the more smoking, the more bad cholesterol, it builds up faster. Diabetes accelerated until it reaches a point in which it can go pop. It's like a pimple burst within the arteries. And then you form a clot, because the body doesn't know that the artery burst from within, which tries to form a clot. So it's bleeding. Because usually if you have a cut, your body tries to form a clot to prevent you from bleeding to death. But when you have a heart attack, it bursts from within the artery, the pipe, to the heart. And then it tries to say, let me stop the bleeding. So it forms a clot on the inside. By forming a clot on the inside, it blocks the circulation going downstream. So the muscle to which the artery goes, like the pipe, is blocked, and then the heart downstream dies. Okay? So that's how hypertension works. The leakage of the cholesterol from the small vessels underneath the pipes, and then diabetes causes it to speed up. The bad cholesterol causes it to build up much faster. It's just like hardening of the arteries. Right. You ever see a rusty pipe when you have these gunk on the inside? So that's like the LDL, the bad cholesterol causes that. So the good cholesterol is like drainer. So if your sink is blocked or your pipe is blocked, you throw a drainer down, it opens it. And that's what the good cholesterol is, HDL. So if you want to keep your pipes clean without any blockage of any of the plaque, then you need to give your good cholesterol up and bring your bad cholesterol down. And how you do that? By exercise, eating lots of vegetables, fruits, things like oats, grains, whole grains, and less processed food. Things that have lots of sugar and flour and processed stuff. Try to avoid those things. Okay? If you smoke, don't smoke. Right? Ganja, yes. Just remember, there may be some good stuff in ganja, the THC and CBD. Yeah, but no. Smoking is bad for you. Cigarettes, the nicotine cause spasms, and that can also affect it. But also when you smoke, you produce like 50,000 cancer-causing chemicals. Whenever you burn any organic matter, you get a lot of, we call these like cancer-causing chemicals, things that causes inflammation of the body. Right, so even with ganja too, there may be some good stuff in it, but the bad stuff from the burning can go through your lungs and affect your arteries, right? So I am for the criminalization of ganja legalization. I'd rather you get the good stuff from the ganja tea rather than smoking it. Until they legalize it, though, I can't prescribe it, okay? But hopefully that's going to change soon. We see it as a plant-based, at least we can see this as a plant-based medicine, so they're going to be pushing a whole food plant-based diet rather than a processed stuff. So I have it, I'm glad it's on the TV, so if it's working, you're going to cut it out? No, good. Oh, I can stand by what they say here. Ain't free. Okay. Alcohol, they say that alcohol is bad. Alcohol is good for you. You drink 1 or 2 if you're a man, if you want a lady, and it helps clean out your arteries. That's just advertising and marketing. When you look at the data, they look at those who never drank, and they see the risk of heart disease was a little high. You drink 1 or 2, your risk goes down. You go more than 2 a day, it goes back up. But the people who didn't drink in the first place had medical conditions. And when they look at the data and they follow them up, they found that there is no safe level for alcohol. The more you drink, your risk of getting heart disease increases, the risk of cancer increases, and so on. Right? So if you think it's wine that gives you the benefit, just drink grape juice. It's not the alcohol and so on. The only thing alcohol is good for is to clean your skin when you're taking blood tests and you're setting up drips. There's no health benefits for alcohol whatsoever. And there's lots of negative health effects. So technically it's a Schedule 1 drug. If any drug should be illegal, it's alcohol. No health benefits, lots of negative benefits. Have you seen the cancers, pancreatic cancers, pancreatitis, liver disease, cancer of the liver, stomach, getting cancer, ulcers, accidents, domestic abuse, fighting, and so on. Ganja, unless you smoke too much, you get like cigarettes. It has lots of positive benefits, and not much. It just makes you chill. It just makes you irie. Right? It doesn't make you do what you don't do. So if you're a calm person, just calm you more. However, a lot of young people have lots of negative energy and who are very angry, amplifies it. So whatever you have, it kind of adds like fuel to the fire. But if you're good, you have a good family background, and you just want to meditate and be at peace with everybody, I would never recommend somebody less than 25 years old whose brain is developing to use ganja. Because the brain is developing. Above 25, ganja tea. Now there's a lot of studies that suggest people who have Alzheimer's, Parkinson's, strokes, neurological problems, they benefit from it. So the health benefits is mainly as you get older. Because any brain is developing, if you take too much of a good thing, it can cause abnormal development of the brain. And once the brain is developing, I don't want you to put any substance, whether it's too much good thing. You don't need it. There are other ways to develop your brain to be irie and high on life without smoking the ganja. Drinking the tea at night to relax you is okay. Lots of women have PMS. That's the only thing that works for them. So why deny them the medical benefit when they know it's there? So if you look at it, there's lots for vomiting, nausea, seizures, glaucoma, pain. There's lots of medical benefits for ganja. It's just that research wasn't being done. Any negative benefits, unless you mix it with alcohol or cocaine, like Sprana and Brown, then you get the negative benefits. But the pure ganja doesn't have that effect. So ganja should not have been illegal. It wasn't for any health or medical reason, right? It was a political reason in the States to divide communities, right? So it was used for, it was a racist element there. I mean, if you look at the history, you find out. Okay, sorry I went off, but
Don't think, okay, ganja is when you start to smoke, because the other 50,000 things can affect your heart and your stroke and so on. Right. Okay. Exercise is good. Once you exercise, it helps with the heart. It releases a lot of nitric oxide that increases the circulation, and your heart becomes more efficient. It brings down your blood pressure, it controls your sugar, and that would help to decrease heart attacks. So if you don't exercise, you sit down, pressure goes up, sugar goes up, you put on weight, you get stressed out, and that increases your risk of heart attacks. Right? So the final common pathway is blockage of the artery, and the process starts when you're a teenager. How do we know that? They did autopsies of young people in the Vietnam War, and they found they start to develop these blockages in the arteries early on. Right? And it takes about 10 or 20 years before you have complete blockage. And the body just dropped down from a heart attack or stroke or gangrene just like that. These things develop over many, many years, decades. Right? It's just that we don't feel it until we go poof. It's like a pimple bursts inside the artery, which is the atherosclerotic plaque, and it gets blockage there. Okay? So it can be changed, and this was before fast food. That's why we're seeing the 30 and 40 years old now with the heart attacks and the stroke and so on. And again, when we're talking about heart attack, it's the same process that have stroke that goes on with strokes and impaired circulation and gangrene. It doesn't discriminate. It's just you may get your blockage here, heart attack, here, stroke, there, post circulation. If you get one complication, you most likely have plaxia, and plaxia is just these haven't gone off or ruptured as yet. You're just a walking time bomb. Okay? I don't want to scare you all, but a lot of us, if we look, we'll see it there. It's just a matter of time. But it can be reversed and it can be prevented. And we'll talk about that at the end. So I'll give you the facts. This is the truth and reconciliation exercise. Giving you all the truth and how we can reconciliate with our body and be in right relationship with it. So what are the symptoms? How do you know you're getting a heart attack? So we try to prevent it. We hope you never get that, but how do you know you're getting a heart attack? What would the first say? Chest pain. Yes, that's the most common symptom. Chest pain. What kind of chest pain is it?
Severe one that reduced to the back or sometimes I go to the left hand.
Good. So it's usually what we call this chest pain, just below the sternum, the breastbone, and it's usually like a dull pressing, like somebody says like an elephant sitting on the chest. So if somebody comes to you and they put their hand like this, think seriously heart attack. If they come and say, I feel it right here, that's my heart. It's not likely to be a heart attack. Once it's specific and they can point, it's usually a muscle pain or a line of the lung pain. But a heart attack, because there's no nerves in the arteries, it's just a non-specific, they can't pinpoint it. It's like a tightness in the chest. And the pain don't have to be in the chest. You can start in the jaw and go down to the belly. So they may come with belly pain, no chest pain, but they may having a heart attack. And usually it's due to the bottom of the heart having the blockage. So it depends where the artery is blocked. You can get the pain here, 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 the right shoulder too, the right hand. Classically it's down the left hand because the biggest part of the heart is the left side. The left ventricle is the biggest, so this is where most of the time you get the blockage and the effect. It can even be in the back. Right? So not everything that's chest pain is heart attack, but not everything that is belly pain, hand pain is not heart attack. So that's why you have to take a good history. So what are the symptoms a patient may have besides the chest pain? Now, anytime you have any severe pain, you get nausea and vomiting. So they may come with vomiting. Some people may come with belly pain and vomiting. You say, oh, it's gastroenteritis or gas, when it could be a heart attack they're having. Right? So a lot of people say, oh, I have the pain. So they come in and say, oh, I take the pain, I went and take some Deca, I went to sleep. And then you don't wake up. That's what the family will tell you, or they were having gas and then they're dead when they check in the morning at home and so on. So nausea and vomiting. Nausea, vomiting is whenever you have pain, you get that. You can get sweating. So anybody come with chest pain, vomiting and sweating, You can also get shorter breath because the heart is a pump. If you get a block, it's not going to function properly, as you mentioned. That's why it's a big deal. It doesn't pump properly. If it doesn't pump properly, if it's the left side where you're having the heart attack, you have fluid backing up in the lungs. So then they may come with heart failure, shorter breath, can't catch the breath. Or they may get blackout. Stop beating, they go into what's called ventricular fibrillation, they have a cardiac arrest. The blackout go unconscious. Sometimes they come back by themselves spontaneously, right? Or you may have it on the right side, in which the right side can't pump enough to go to the lungs to go back to the left side. The pressure go low, and they get very weak and tired, and they can't stand up and so on. Okay? So all of these symptoms you can get: chest pain, belly pain, jaw pain, arm pain, back pain, vomiting, bad feeling, sweating heavily, shortness of breath, can't walk, right? And 25%, as they get in the heart attack, they die on the spot. Sudden cardiac death. Right? Those are the lucky ones. Because when you die, you're resting in peace, you don't suffer. Those who have complications, they may get heart failure, they can't even walk from here to here. They get tired and have short of breath. But don't be selfish. Don't hope that you get a heart attack and that's it, you rest in peace, even from earthly life to heavenly life, or hellish life, we don't know. But who suffers when you die? Your children, your family, your community. So don't be selfish. So the whole idea is not to hope that if you do get a heart attack, you just die on the spot. Although you're resting in peace, your family's not going to be resting in peace. I don't know where that term comes from. We should say also live in peace. Live in peace with your heart and everything. Okay, so those are the symptoms. Anything else I am going to forget? You all the nurses, any other symptoms you may get? No. Signs. So when I listen, also when you come, first thing I do is look at the vitals, look at the blood pressure, look at the SAT, because heart failure can give you shortness of breath. Right? I listen to the heart. Now, listening to see if there's any murmur. Because sometimes when you have a blockage of the artery, the valves, you get regurgitation, they don't close properly. So if I hear a new murmur, the patient may be having a heart attack. I'm listening to the heart sounds. I hear an extra heart sound called an S4. That means the heart is not able to relax well because it's not getting circulation. So when I listen, I can pick up at the bedside, even before an EKG, that you're getting a heart attack. If the heart is weak, you're going to get backup of blood. So listen to the lungs to see if you have any fluid in the lungs, and that's called heart failure, right? Again, also, you may be having a dissection of your aorta, so I feel the pulse. So although I'm thinking heart attack, I need to think of other stuff, like pulmonary embolism, that's a clot going to the lung. You rupture a major artery of your body, the aorta, which one of them you have to give blood thinners, the other one you don't. And if you make a diagnosis of heart attack and give blood thinners, but the patient's having aortic dissection, you basically accelerate the demise of the patient. So you have to know what you're dealing with, right? So not everything that's chest pain is a heart attack, right? So you have to know, make the diagnosis. So that's why you look at the history based on the symptoms the patient presents with, and you look for signs based on the physical examination and investigations. So somebody comes with chest pain, you tell them, if you think that's the case, so you educate the patient, they usually take an aspirin. If they don't, when they come, take a quick history, and within half an hour you do an EKG as they come to the emergency room. And you're looking for signs of heart attack. We see changes on the EKG that suggest the patient has a blockage in certain arteries. Yeah. You can also see signs of clot in the lung, pulmonary embolism. That's very important. And we can do blood tests. But the blood test is going to be negative within 8 hours. So if you're having a heart attack now and you come to the hospital, the blood test is going to be normal. That doesn't mean not having a heart attack. But if you say, oh, blood test normal, troponin negative, patient can go home, that's dangerous. You need to repeat the EKG in like 4 hours time, ideally 8 hours, and do the blood test. We call it the troponin, looking for signs of heart damage. And usually if the troponin is negative after 8 hours, then they're not having a heart attack. If there's changes on the EKG, where the troponin, the cardiac enzymes are negative, then they have what's called unstable angina, which can go on to a heart attack. So we treat it seriously, and that's why they still need to be admitted. So the next couple cases may come, you misdiagnose them, you send them home, and they come back in dead, or they don't come back in at all. Okay? So, a negative result from a blood test doesn't rule it out. So you have to have what we call a high index of suspicion. And how do we know? If they have the risk factors. If they're hypertensive, diabetic. Also, diabetics may have complications of the nerves. They can't feel well. So some people have what's called silent heart attack. So they may not come with chest pain. They may come with a complication like shortness of breath, tiredness, right? A little nausea, vomiting, but no chest pain, because the nerves that send signal with pain, the diabetes affect. Like people, they don't feel their toes, they get numbness, they can get numbness of heart attack. So again, if they're diabetic and they come with vomiting, you always do an EKG to see if they have any changes that suggest they're having a heart attack. You can do some blood tests. Now, they may come with problems like a week ago. Now, the troponin can be positive for 2 weeks. So it's always good when they come to do it. If it's positive within less than 8 hours, then they had the problem more than 8 hours before. But if it's negative, that doesn't mean they're not having one now. You just repeat it in 8 hours' time, right? I mean, in Jamaica, we used to have these pregnancy kinetic kits that you can do the troponin right over here. You have to send off to the lab and so on. It's something we probably need to look into. So we do EKG, we do blood tests to make the diagnosis. So the classic, we call it the triad: symptoms, the EKG, the blood test. You only need 2 out of 3. So if they have the chest pain, typically you don't have to wait for blood tests to treat. Because if they're having a heart attack, in which we see the change in the EKG, we can in the emergency room or right away in the ICU give them medication to kind of dissolve the clots. So if they come in early, within 12 to 20, used to be 12, now it's 24, but within 12 hours, and I see they have the ST and there's no what we call contraindications. I mean that it's safe for me to give them blood thinners like streptokinase, then I can give it to them in the emergency room and help to unblock the clot to limit the damage of a heart attack. In the big countries, they have a cardiac cath lab. It's take you straight down there, do an angiogram, dissolve the clot, and put in a stent. But we don't have that here, right? Streptokinase, that's what we should always have in the emergency room. If we don't have it, we should always. So the diagnosis, 2 out of 3. The prognosis, it depends. So if you look at the anatomy of the heart, you have a major vessel coming down. It's called the left main arterial coronary artery. If that gets blocked, most of the heart can die, and the heart can stop. If it's the underside, you may get low pressure. Okay. If it's just a small artery get blocked, it may just be a little bit of loss of function. The treatment. So when they come, it's a clot due to a rupture. So what we do, we start them on blood thinners. Aspirin. And there's another one we call Plavix. Right? So they chew on it right away. We give them Plavix. It's like it works against one of the blood cells called platelets to prevent the clot from extending and blocking off more downstream. And we give something called heparin, no molecular weight heparin or plexins. We use lots of blood thinners to help dissolve the clot as quickly as we can, right? In addition to the clot busting one. So if it's ST, we call it STMI, we use the clot busters like streptokinase and aspirin and heparin. If it's not ST or they come late, then we don't use the streptokinase, the clot busting, but we use blood thinners to prevent it from extending. Okay? And the complications, heart failure, you can get an arrhythmia. And that's why we put them in for 24, 40 hours in the ICU, because the heart can start to become very irregular and it can stop beating. And we want to pick it up because you only have 4 minutes of a window period. So if your heart stops beating, it's not beating regularly, and you don't get blood going to the brain for 4 minutes, you're going to become brain dead. But if you're in the ICU and you detect it, the nurse can start CPR right away. You can start trying to help to get the heart beating by giving adrenaline and things like that. And we can bring it back. We can shock the patient. You call it defibrillation, and we've done that several times. Right? So that's why we put them in the ICU. And that's a critical period. Right? So you can get heart failure, you can get what we call ventricular fibrillation or cardiac arrest. And with time, what happens, the wall gets thin, if it's a massive MI, and it can burst. You can get an aneurysm of the wall and rupture, and you get cardiac tamponade. Right? So again, this is when the heart muscles burst, and then the blood goes in the sac and prevents the heart from bleeding. And this can happen within weeks, 2 months after. So, how do we prevent heart attack? Because none of us have had heart attacks, so we want to know how to prevent it. Again, you have to look at the risk factors. The major risk factor is age. There's no tablet for age, right? You can't slow it down. Even plastic surgery can slow that down. Okay? And interesting, when people go to do an angiogram and they get a stent, they get bypass, it's actually plastic surgery of the arteries and of the vessels. It doesn't slow down the process. So we mentioned diabetes is one of the major causes. High blood pressure is another cause. Being overweight and obese is a cause. Not exercising, not getting enough sleep, too much stress, not getting enough healthy food, right? Eating a lot of junk food, and of course, smoking, heavy use of alcohol. So if we can change our lifestyle, because now we know heart attack is a lifestyle disease. When they looked at indigenous, these are like local communities who weren't like westernized, right? So like the different groups in like Australia, Africa, hunter-gatherers who develop, eat the land, food from the land. The pressure is very low. They don't have diabetes. They don't have high cholesterol. They don't have cancers. So it's our food that's killing us. Modernity, modern lifestyle is killing us. We think we are civilized, but we're actually doing more harm than good to the body, right? So we can prevent it by maintaining healthy weight, exercising at least half an hour a day, brisk walk. You don't need any expensive. You can just get a good pair of sneakers for walking, ideally outdoors with sun. Because the vitamin in the sun actually helps with your pressure, helps with your immune system. Even with COVID now, you've seen people with COVID getting heart attacks and strokes. Right? It's part of the lack of vitamin D that's increasing that. Eating healthy, right? So you should eat a whole plant-based diet. A lot of fruits, vegetables, whole grains, legumes, pulses, right? Eat from God's factory, which is the soil, and from man's factory, which is the supermarket. Don't eat anything that is processed. And the sugar, sweet beverages, and the ultra-processed food, avoid. Things that have lots of flour, sugar, salt, avoid. Right? Because once it's processed, it messes up your hormones. And this causes sugar to go up and down, and it's the high sugar and the high cholesterol, the bad cholesterol, the low good cholesterol that accelerates the plaques in our body that, when it ruptures, causes the heart attacks. Okay? Don't smoke or drink your ganja tea. Avoid alcohol. There's no health benefits. You don't need alcohol to lively up yourself. It's good company, healthy food. Don't sit down, because now they say sitting is the new smoking. By sitting down, we increase the risk. So now if you look at people like Facebook and Google who work in these things, a lot of people in big industries, they have a walking treadmill. So they're walking at work on a treadmill and they're working there. So they're always on their feet. Get 7 to 8 hours sleep.
When?
Huh? When? You go home, not on the job. I know it's difficult, but they actually find that sleep is more important than we should think. That's when our body helps heal the wear and tear and so on. And they have a natural experiment. So what they found that, for example, when they have daylight saving time and you lose like an hour's sleep, this is look around the world, half heart attacks and strokes go up by about 20%. And when you have the other, you go the opposite way and you get an extra hour's sleep, it goes down. So that's a natural experiment. So even an hour difference can make a difference in the rates. I'm not joking. Just Google it and you find out. The sleep is much more important.
Get to 8 hours, but not until the hours.
7 to 8 hours. And so on. Right? I know it's easier said than done. I mean, in medical school, I wasn't getting much sleep. And my professor used to tell me that sleep is just a concept. He was wrong. Right? So, again, we know that sleep is actually healthy for you. Sunlight, exercise, lots of greens. Now we know that greens, there are things called nitrates, like spinach and kale. When you eat it, a lot of it goes underneath the subcutaneous fat layer. And when the sun hits it, it converts it to nitric oxide. That opens up your arteries and increases the flow. And you know what's nitric oxide, right? Mm-hmm. It's one of the, you can get it artificially. It's one of the number one selling drugs in the world. Viagra. So exercise with sunlight and lots of greens, you get your natural Viagra. So you see a lot of ladies here, just ask your boyfriends, husbands to go walking every day, get some sunlight. I guarantee you, you'll be very happy at the end of the day. Because when the occasion arises, you'll be able to rise to the occasion. Yeah, you see? So not only is good for your heart, it's good for your love life. Right. And then there's a saying, ED equal ED. Erectile dysfunction is early death. Because they call the artery of the penis the canary in the coal mine, because it's the smallest artery in the body. And if a young guy, 40 years, come to me and he complains of erectile dysfunction, I'm looking, he's at risk for a heart attack and stroke. So I'm looking for cholesterol, looking for diabetes, stress, not sleeping, and so forth. Okay? So I'm joking here.
You have those?
Yeah, I have some young guys. Let me tell you, I've had a couple 30s and 40s with heart attack over the past year. So that's what concerns me. I'm glad I was asked to speak on this, because we're going to see a tsunami of young people, because the risk factors are increasing. With COVID and stress and anxiety, who knows what the long-term consequence is going to be. But my patients, after the lockdown, the average patient put on about 15 pounds. Do you know what happens to the pressure control, the sugar control, and so on? So all we worry about people dying from COVID, people worry that more people are going to die from the complications of the lockdown and the social distancing and things like that. So that's the major debate in the big countries. Are we doing more harm than good? Although we have good intentions in protecting the vulnerable, we're very worried about other collateral damage. Okay? So how do we go forward from here? Okay, this is Sunday, right? Who has a personal relationship with their heart as their Lord and Savior? How many times do you sin against your heart? When you don't exercise? Right. But you know your heart forgives you, right? It has an amazing ability to heal. Right? So don't take it for granted. It's a gift from the Almighty. So you take good care of your body, and your body will take good care of you. If you put garbage in, whether thoughts or food, you're going to get garbage out. You're going to get strokes, your heart attack, poor circulation, poor nature, right? Mess up your love life. Right? And what worries me, guys could have, they say they don't care if they have the stroke, they want the nature to work. They're more concerned with the little head than the big head. Which scares me. I don't understand that. I mean, you can't talk, you can't walk. And if out of all the complication for a blocked artery, a stroke is the worst complication. Again, although we're talking about heart attack, it doesn't discriminate. What could happen here can happen here and here. And you can get a stroke on your left side, which controls your language. So you'll be able to speak, you may not be able to swallow, you may not be able to walk. Because you can't swallow, you have to put a tube down for you, so that you don't mess up yourself and so on, put a tube in your penis. then you can get bed sores, and then somebody will have to wipe your bumpsy for you all the time. Unfortunately, you may not die. That's why I say when people die suddenly, well, they rest in peace. Those are the lucky ones. But everybody around them suffer because you're going to get caregiver burnout. That person was a breadwinner of the family or skilled person of the community. We've lost them. So the whole thing is to prevent it. Don't be selfish. Because your loss is not just for yourself, but for your family and your community. So we need to have a personal relationship with all of our organs. Our brain, our heart, our lungs, our kidneys, our liver, our legs. Right. Anything else that I haven't mentioned that you want to go over? Any questions?
Tingling sensations.
Where?
Hands and
Right,
feet.
right. So with a heart attack, anything that goes below the navel is not related to the heart attack. But once you have tingling sensations of your fingers and your feet, you have to start to think of what's called a neuropathy. And if it's symmetrical, it means on both sides, then it's something within the body that's affecting everything. And the most common cause is diabetes. Lately, I've been seeing a lot of these cases, tingling of, and usually with diabetes, it's honestly very, very late. A very poorly controlled diabetic, it shouldn't reach the hands. It's usually the feet in a kind of stocking distribution, and it's when it reaches up to the knee or so on, then you start to get the hands. If you get both the hands and the feet, you're talking about something's irritating the nerve. Okay, so this is not regarding heart attack, but it's something I've been noticing. So since 2017, I've been seeing lots of patients with these weird symptoms. They're not diabetic. Working them up for what we call neuropathies like lupus, rheumatoid arthritis, B12 deficiency, all come back negative. And you know what they have all in common? They eat a lot of fish. Right. So, there's a toxin called ciguatera. It's usually in the big fish, like cavalier, barracuda, snapper. And when you eat it, you get what we call acute fish poisoning. The toxin goes against the nerves. It causes the vomiting and the diarrhea and affects the nerves to your heart. So your pressure falls and your pulse rate falls. So somebody comes with nausea, vomiting, pressure low, and pulse rate low on the background of eating one of those fish. It's the classic fish poisoning. But that's not what I'm seeing. I'm not seeing people vomiting and diarrhea. I'm seeing people with the tingling of the hands and feet, the hot and cold going down the leg, the tingling around the mouth. I'm also seeing patients with complete heart block, seeing people with prostate issues, but when you do the investigations, the prostate is not enlarged, the PSA is normal, something's affecting the nerve. I had a guy who had complete heart block, he needed a pacemaker, but he couldn't go overseas. So I said, well, I'm seeing this pattern, avoid fish for ever. There's certain food that interact with fish that exacerbate symptoms, like nuts, alcohol, and caffeine come off that. So 3 months later, he was back in normal science reading. His complete heart block was gone, he didn't need any pacemaker. Now I discussed this in November at one of the symposiums we had in the Taiwanese team. And there was a lady I saw about 10 years ago who developed complete heart block. She was there. And we told her to Puerto Rico, she got a pacemaker. And after I told her the story of this patient, she got up and was angry at me. She said, Doc, I eat lots of fish. If I had known, I said, well, I only found out about 3 years ago. And how I found out, I had this young girl, she was in the clinic at the hospital, and she came with this kind of burning down the leg. And I thought she had a pyelonephritis. She kept coming to the clinic and treated her with the antibiotics. I said, I don't know what's happening. Let's see, come back. And the full physical, I didn't see anything. The next day, the doctor saw her boyfriend, and he had the same symptoms. I said, no, can be a urine infection causing that. What is it they have in common? They both eat fish. And this wasn't the big fish. These were the small fish, the hinds, the tongues, the pot fish. I said, okay, well, maybe that's 1 or 2 cases there. And then I started to see cases and so on. So I asked my colleagues, and nobody answered. I started to get scared. I said, boy, a lot of people livelihood depend on fish, And, they have Spratnet boys down there, they have a livelihood based on that. If I start to do that, boy, somebody will call the gunman for me now. I got to get scared. Because I'm taking money out of people's pocket, and we hear about the fisheries really investing lots of money in it. I'm seeing it more and more now, and I gather that the emergency room now getting some more fish. I think what happened is when we had the storms in 2017, it actually kind of stirred it up, destroyed a lot of corals, so the phytoplankton going up. Fish is like a sponge. It like magnifies, it bioaccumulates and concentrate. That's why it's the bigger fish that does it. Just most of the fat is in the grain. If you eat the grain of the fish, you get the highest toxicity. But if the concentration is going up, right, and the small ones are affected, then it's very, very high. But then I started to see other things with fish besides this fish poisoning. I had a couple of diabetics who get the sugar control. They're exercising, they're avoiding processed stuff, and the HbA1c is 8, 9, 10. I said, let me stop this. What is it? She said, she eats fish. I said, okay, fish is supposed to be healthy for me. You're not eating the processed carbs. She said, let me do a search. I came across this article, and they compared people who only eat 1 serving of fish a week, and compared those who don't eat any fish at all. And those who eat the fish were 4 times more likely to develop diabetes than those who don't eat fish. So fish is now a risk factor. But we thought it was protective. I didn't know this in med school. And then when I started to say, and the people who found this result, they were perplexed. Why? And they realized it wasn't the fish, it was the environment. What was causing it? And they realized that the plastics in the ocean was breaking down into microplastics. And those microplastics were breaking down into a chemical called BPA, bisphosphonated A, which is an endocrine disruptor, a hormone disruptor. Right? So it's not the fish per se, because fish used to be the healthiest meat. But it's the environment with the pollution from the plastics that's affecting the hormones in the body to regulate the diabetes and so on. And so it's like estrogen. And then things start to connect the dots. We have lots of fibrocystic breast disease. We have lots of polycystic ovaries. We have a lot of cystic issues here. We have a high incidence of prostate cancer, which is hormonal. Breast cancer is hormonal. Ovarian and womb cancer. So maybe that's why we're seeing the uptake here. And then not only the ciguatera fish poisoning and the plastics breaking down, you realize the mercury in the region is 4 times upper in That's why we encourage all pregnant ladies not to eat fish. Why? Because the brain is, it's the same thing with ganja. I mean, you shouldn't when the brain is developing smoke. So you don't want any toxic and heavy metals in your food. And mercury sometimes usually comes from, we have fossil fuels, like Trinidad, the oil, Guyana want to go there, that is spilling the Gulf, so mercury is very high. And that's not all. And then I discovered that 80 to 90% of the waste, the runoff in the United States from industry and mining and agriculture go into the Mississippi River, right? And there's 90 miles of the Mississippi River called Cancer Alley. And they find there was the pesticides, the glyphosate. And we used to get these allergies and so on. And they causes leaky gut syndrome and foggy brain syndrome, leaky kidney syndrome. So even kidney disease is increased. And I said, okay, well, that's the United States. But what's below the Mississippi River, the Gulf of Mexico? And what's below the Gulf of Mexico, the Caribbean Sea? So we're the dumping ground for a lot of these pesticides and these chemicals. So yes, fish was the healthiest, but now the ocean is polluted. So that's 4 reasons why I discourage my patients who have symptoms from eating fish. If you don't have symptoms, you probably have some reserves, tolerance. but eventually it's going to catch up with you. It's like, they call it the boiling, the frog in the boiling water. Once you slowly heat up, your body get used to it. So a lot of people feel tired and they think, oh, that's normal, getting old. But these are the toxins from the fish that's causing that. And once they come off of it, you get it to detox. How do you detox? You stop it, and eat a lot of greens, which actually the chlorophyll helps dry it out. So you have less toxin in and more detox. And eat healthy fruits and vegetables in Victoria, and so on. So to answer your question, diabetes is one of the most common, but it's your hands. And if you do eat fish, and I rule out diabetes and other causes, then you should stop eating. Even tuna and sardine and saltfish. And when I tell my patients that it's called fish, it's from up there. And I start to talk about Fukushima and the waste of the radioactivity that's come off in the Pacific. And you can't, like what Trump said, build a wall around the Atlantic Ocean, everything mixed up. And what's even worse, even the water cycle, things are actually circulating. And when you have storms that mix up the ocean, everything is everywhere. So everything is bad. So the Rastas have it right. Go back to the soil. Yeah, there's some, but they shouldn't. I mean, the true one that eat, they are vegans, not the pescatarians. The vegans eat from the soil organic, no pesticides. Unfortunately, a lot of farmers use pesticides, which actually does more harm than good. It kills the good bacteria in the soil, and it also kills the bacteria in our gut. So our immune system from the planet is destroyed, the immune system in our gut is destroyed, and as a result we get all these allergies to everything like that. And a lot of overeating and so on is caused by inflammation in our body. So bad eating can cause inflammation, but the toxins from the pesticides and so on can cause inflammation that causes us to overeat, not sleep well, get groggy, you don't want to exercise, even depression, anxiety. So everything is connected. So again, take good care of your body take good care of you. Put good information in either by food or knowledge or thoughts, you'll be able to get good output. Eat badly, think badly, you're going to act badly. Yes?
With this, what we call it, organic, the organic rice. How organic is the organic rice?
Okay, the term organic means that you don't use any artificial chemicals like pesticides and so on. The major one is Roundup, glyphosate, which when it goes into the soil, now we know it kills bacteria that produce essential amino acids, right? And that makes, so you get the plants, they are nutrient poor. So you think you may be eating healthy, but you're not eating healthy because they're nutrient poor, toxic. So when we say organic, we say we're not using any of those chemicals. So the soil is healthy. And if you have soil health, you have plant health, and you have animal health and people health. If the soil is sick because you kill the good bacteria and you have toxins, then your food, even though you think you're eating healthy, plants would cause a lot of inflammation in the body. So a lot of the people who are doing research, they were surprised initially. So when they tell the patients to eat healthily, they found they weren't getting better, and they realized it came back to the soil. And we now know that although they say the GMOs and the glyphosate doesn't affect human cells, our body contains 100 times more bacteria than human cells, and that's the first line of defense of our body from chemicals on the outside. So they digest our food first before it's absorbed in the body. So if you kill the bacteria that's in the due to the glyphosate in the food, in our cereals, right, because of wheat and so on, corn and so on, that's have the Roundup, the pesticide, then you're going to get sick on the inside.
With the cane fields that we have here, how soon could you go into that field and say you're doing an organic plantation? The cane fields that we have here,
right. So usually the good thing that's different from the ocean is Once the rain comes in, it washes it out in the sea. Right.
Oh,
But once you go into the sea, I mean, how do you wash it out?
exactly.
Some would say, well, you could dilute it
Yeah.
by melting the glaciers. That would cause sea rising and so on. So again, soil is our richest asset, right? If you check, because my wife used to work at the water department, and when she was there, they did an audit of the aquifer, and they didn't find any of the glyphosate or the chromium that you can see in the water. But that's after we closed the sugar industry. But here's the problem, I suspect they use a lot of it back then, and we have gone into the aquifer.
Yeah.
It's not there now, but how much of us have been exposed to it? And usually when you look at cancer and so on, it's usually 20, 30 years down the road. So not only to the recent the toxins in the fish now, but maybe some of the uptake in the cancers is from our exposures later on. They actually did a study of prostate cancer around the world, and they found Martinique had the highest rate of prostate cancer. The second was like 2 times less than that. And they were wondering why. When Martinique, they were growing a lot of bananas, and they used to use a lot of pesticides. And that's where they think the connection is. So another reason. So, I mean, Monsanto, I mean, it's a crime against humanity. I mean, our farmers still using it because if you don't heal the weeds, now there's a new thing, instead of industrial agriculture, it's called regenerative agriculture. You use crop rotation, no tilling, everything is organic. I mean, so you have different crops growing at the same time, that keeps the weeds down. Once you have we call a biodiverse, I mean, many different things growing. You can do legumes, tubers, different stuff. They each kind of work together in harmony and protect against like pesticides. Pesticides germs come because we kill off the diversity. So it's the monoculture crops that creates the vulnerability and so on, and become susceptible to these things. So a lot of farmers now, they don't use tilling. When you till, you kill a lot of the fungus that allows the plants to communicate. And they use the manure from animals, and they have cows and so on. Although I'm plant-based, right? If your chicken is yard reared, organic, right? If your pigs and your thing, or your cow is everything organic and so on, then they will be much healthier than if they're raised with lots of hormones, antibiotics, and they fed corn, which also has pesticides and so on. So again, it comes back down to our food.
What are we supposed to eat? Should be
Fruits and vegetables, a wide variety of
should we
fruits and
just eat
vegetables.
black? But that's expensive.
Why are they expensive? Because we import them. 80% of our food is imported. Why can't we be the breadbasket for the Caribbean? We have lots of land here. Isn't Liamiga mean fertile land?
That was what meant when they wouldn't be the cane crops.
Yeah. So yes, we may have kind of leached out the soil, but again, we have to start. And once you start, and now when they realize with global warming and trying to deal with climate change, therefore most of the carbon is not stored in the trees, it's stored in the soil. And when you look at the soil, it's a rich, you have earthworms, fungus, bacteria. And once you get that started, everything is captured in the soil. So soil is where life begins. Right? And we don't take it, and we take it for granted. Why don't we get our primary schools acquainted with the soil? Ask them where carrots come, they probably say from supermarket, Rams or IJ. Some people don't know that it comes from the ground because they see the mom go to the supermarket and buy it here. So we need to get our culture back.
Sun is too hot.
No. Right. I know our history, because of the sugar industry and so on, we were growing monocultures to enrich people overseas, the absentee owners. That's servitude. When you grow food for your community, that's service. You become valued. Farmers can make lots of money, more than doctors. It's hard work, but it's satisfying because you become the doctor of the community by keeping them healthy. Let food be your medicine, and medicine be your food. So they are the real bankers. That's where the real value is stored, is in the soil. So we need to liberate our lands, teach. I call them soil scientists. Right? And that's where all of the research is going now. How can we have multi-crops, enrich the soil, help to combat climate change, and at the same time be self-sufficient? No, this second wave coming, I mean, we talk about COVID, how about influenza season? There's a possibility that we're going to have food shortages. Just remember, we're going through the thing in winter. And then if 80% of our food is imported, what are we going to eat? Plastic? So we need to get our house in order, get our lands productive.
But if no rain coming,
The rain is coming now. If we need to go to desalination, if we need to catch the rain so it doesn't waste it, so it goes to the aquifer, we need to. Food and water security is number one for any nation. Once we lose that, we're in deep trouble. Right? So we either, right, come together as brothers and sisters, or we perish together as fools. Right? The evidence is there. I mean, I can't be any clearer than that. Right? Get our soil mobilized, get the latest update, not with technology, but the knowledge how to grow stuff. And then once we can tend those gardens without bringing on the soil, then we know how to look at the gardens within. Let me ask you a question. The metaphor of tending the garden. If you have a seed and it doesn't grow, would you blame the seed? No. I mean, if you didn't get enough water, sunlight, or the soil is poor, the environment is poor. Same thing with human beings. If a human doesn't flourish and he gets sick, you don't blame the person, you blame the environment. The laws of the country, the policies, the programs, the practice, the rituals. So we have to be in right relationship. And by dealing with the soil and know how it is to tend the soil, we know how to tend the body and the vulnerable. The kids are like the seeds. The home is like the flowering pot, right? The community is like the garden, right? So that's the soil of understanding and learning, right? Life is not complicated. We make it too complicated. Just let's simplify. Be in right relationship, right? Take good care of your body will take good care of you. And just give it the nourishment it needs. We call that love. Right? This is not church here. Right? What's the greatest commandment? This is medicine. What's the greatest commandment?
love yourself.
Love the Lord your God with all your heart, soul, mind, and spirit. And love your neighbor as yourself. So, love God. Love all creation. Love the soil. Love the plant. Love the ocean. By dumping the plastics there, by global warming, we're not loving God, we're hating God. We're destroying His creation. We're destroying the life support system of the planet. Love your neighbor. Who is your neighbor? The Samaritan that the parable Jesus gave was the enemy of the Jews. And even his own, the high and mighty divine, the high priest, ignored it. He took an enemy to look and said, that's his neighbor. So everyone is the neighbor. So that's the life support system of society. Education, health care. And last, how do you love yourself? Right. It's not masturbation. Right. It means you're taking good care of yourself. You have a relationship with your brain, your heart, your lungs. You take good care of it. That's how you love yourself. Because if you smoke heavily, smoke or drink, don't exercise, you're not loving your body, you're hating it. And when you get your heart attack and stroke, you won't have yourself to the end. If the community doesn't give you that supportive environment, and you drop down, or somebody at home drop down, somebody at work drop down, it's the environment to blame. For the nurses, is it stressful at work?
How do you know that?
Right, so that is increasing, that creating disease. So we need to work on the soil of the work environment. So it's nourishing, less stressful. And finally, the laws of society. Why is it the healthier choice is not more available, more affordable, more accessible?
It's true.
Right. So we need to change the soil of thinking, of the rules of engagement, pass laws so that it's much more available. Do we have lots of conflict of interest? Yes, we do. Do we have any politicians have ownership in fast food businesses?
Of course.
Of course. So what signals are you getting there? So if I start to talk out about fast food and encouraging more slow food, I mean,
You have no business.
right. Now, you know who did this? They had this mad cow disease in the 80s,
Yeah.
and Oprah said, not going to eat from McDonald's or Burger King anymore. Sales started to go down, they sued her. Luckily, she had the money, and she got Dr. Phil and some high-powered attorneys, and she won. There's a law in this state. If you, as a government or a written person, say something that causes big companies to lose profit, they can sue you for profit loss. So, the financial health of companies trump the health of individuals, of the workers, and the communities. Right? So, I empathize with lots of politicians. They may want to pass laws that's in the best interest of the country, but they can end up getting sued. Even with this COVID thing, right? It's best that we keep our borders closed until America and the states get everything in order. But they're going to get sued by or they have to pay to make sure that American Airlines and Delta and so come here. If they don't, they can get sued big time for profit loss. So our health is not important, but their bottom line is more important. So there's major, major conflict of interest, and until we change the rules of engagement at the highest level. So I'm calling for international judicial review of all the rules, from environmental health to worker health to individual health. Until that changes, we're going to end up killing ourselves slowly. It's going to be a race to the bottom. So although I individually, you individually want to do the best, which you can, it's going to be much harder. Look how much easier it can be if we all come together and put our health above profits. Yeah, but then we have to accept the inevitable. We're going to be slowly dying, and we think, okay, that's life, that's nature, but that's not nature. That's anti-nature. Because God didn't create an imperfect world. He created a perfect world. It's our opportunity to acknowledge that and work in harmony with Him.
Dr. Seely, now we hear about baby aspirin. So would you recommend that we take baby aspirin a day? And secondly, in taking the baby aspirin, what do you think is the best thing for us to do? Put it under the tongue instead of chewing it?
Right. Okay, so before we used to tell everybody who have risk factors, like who have hypertension, diabetes, take a baby aspirin a day to decrease your risk. Lately they found that more people are getting bleeds from aspirin than those that would prevent from having heart attack. So it's not used for what we call primary prevention anymore. It's now used for what's second. So if you already have a heart attack, then you should take one aspirin a day to prevent that. If you have a stroke, you continue taking aspirin. If it's not a bleed, it's one due to the blockage. How do you take it? A lot of people would take it at night because they say, oh, that's when most people have their heart attacks, is at night. But if you take them on an empty stomach, it can cause problems. So make sure you have food in your stomach before you take it. Under the tongue, I mean, usually if somebody comes to the emergency with chest pain, I ask them to chew it so that it absorbs very quickly. Under the tongue, I've never recommended it to be like that. Just make sure you have food in your stomach. If you have a whole stroke or whole heart attack, to prevent another one. If you don't have any of these complications, really, I would recommend it at this stage because the evidence suggests it may do more harm than good. So just be guided by your doctor. The evidence changes, so on. And don't rely on medicine as you say, by taking aspirin, it'll be okay. Right? It's only protective 30% of the time. So even though some people take aspirin, 70% get a heart attack. So again, it's fine. But we know that if you look at the cholesterol medications and so on, it prevents the progression. It doesn't cause reversal. What causes reversal? A whole plant-based diet. Exercise, losing weight. And you have people who don't need bypass surgery. Say, okay, I don't want any of that. I'm going to have a total lifestyle change. And they find by being disciplined, they improve. So the question is, why can't all of us do that? Why is it all of us can break a negative lifestyle to have a positive lifestyle? I'll tell you why. For you to change your lifestyle, you have to have 4 factors. You have to have the knowledge. That's why education is important, and that's why I always jump for these opportunities to educate the public. Next thing is, you have to have the skills. It's a good thing to say, okay, exercise, but you don't know how to exercise. When you go jogging and running and that mash up the knees and so on. And you tell them you need to eat healthy, but they don't know how to cook. They not know how to read the labels and so on. So you need to develop the skills, right? But how many people have the knowledge and have the skills, but still don't change their behavior? How many doctors you know smoke? How many doctors you know drink lots of alcohol? How many doctors you know is obese? I was obese about November last year, right? I'm an internist. I'm supposed to have all the knowledge to scare the hell out of me, because I see it up close and personal with the heart attack and stroke, right? But that wasn't enough. I can't cook, right? So beggars can't be choosers. So I depend on my mom and my wife to cook food. But they were willing to assist. So I had the knowledge and the skills. I outsourced it to my wife and my mom. They took healthy for me. But I still was obese, right? So we asked me, what are the barriers? Time to exercise. I was giving most of my energy to my work, to my patients, and less to me. I have some women who work on industrial site. They have 5 children. They're obese. You tell them to eat well, exercise. They have to get up 4 o'clock, make food for their kids, get to work for 7 o'clock, come home late. They don't have the time for themselves to eat and so on. Just say, okay, let's make sure they get an extra hour. They can take half an hour to go walking and half an hour to cook healthy food and so on. But to take away 1 hour from business will cause loss of profit. So there's again a conflict between what's good for health and what's good for business. Right? So knowledge, skills, the barriers. So it could be time barriers. It could be financial barriers. The healthier choices are less expensive. Healthier choices are more expensive. Right? Some say, well, no, if you eat healthy, you're going to get less sick. So in the long term, it's going to be cheaper. And if you now go to shop and you go to the market, it's cheaper. But most people say, my wife says, the healthier the fruits and vegetables are more expensive. Some people actually buying them from the supermarket to sell back to you, and so on. Okay, so, but some people, they have the knowledge, they have the skills, they don't have any barriers, but they're not motivated to change. Right? So the question is, what would motivate you to change? What would make you want to make the extra sacrifice? Well, for most people, the first heart attack, but just remember, 25% of the first heart attack is death. My scare was COVID. Right? I was getting some inkling that something was happening around December. Right? And then I realized I was obese. 1. When it comes here, I'll be frontline. 2. Thirdly, be stressed, you make mistakes. Tired, you're going to get a weak immune system. Right? I always had these aches and pains. I was on steroids to cut down my inflammation. I was immunosuppressed. Boy, I was a walking time bomb. So if COVID come here, I'm going to be the first to go down. I have a young family, and that scared the hell out of me. So that motivated me. Oh, I'm going to get a treadmill. Because I have a treadmill, I got it when I moved my house. It was a close hanger. And luckily it was working, so I went on. Because I don't have time to go outside. So for me, luckily, I had the resources for a treadmill, as most people do, and I went on half an hour. And full, whole plant-based diet. Cut out all bread, all juices, 80 fruit, lots of soup, wrong food, wrong provision. Ital is vital. The Rastas know best. You just need to listen to them more. So they practice a plant-based diet plus a plant medicine diet. Plant medicine lifestyle. Okay? It's spiritual, it's sacramental. So food becomes sacramental, not just a ganja, and so on. So for me, the motivation was my family. So once you live for somebody bigger than yourself, then you become motivated. So if all of us concentrate on the next gen, being around to see them grow up, see the grandkids, okay, enjoying life with them. You don't want to be a stroke and be a burden to your family members. Don't be selfish. Don't wish that you get your hat and drop down dead. So you rest in peace. Because you can live in agony and you can put lots of burden on family burn. Caretaker burnout is a big, big problem. Big problem. So not only you go down, but your family members. And you take them out of work, you have less time with the kids because, right? And if they do a good job looking after you, they're going to live longer. That's more burden. So you create some conflict with that member there. So, again, prevention is better than cure. And as Dr. Carty reminded on his lecture 10 years ago, which I adopted, prevention is the cure. And community is the cure. I can't read, but
Then I said I depend on my parents, my mom, my wife, help me with the eat as I can cook. And beggars can be choosers. Unless my family is not on board, and all of us have this healthy lifestyle diet, healthy diet. My kids all started vegetables. My daughter, she likes broccoli, carrots, and things like that.
So what is the protein base?
Right, so you can get your protein from plants, legumes,
Yes, the peas.
beans, lentils, tofu, chunks. Plant-based protein. And guess what? Plant-based protein is actually the healthiest. It's alkaline, a little bit of alkaline water and so on, right? And it doesn't cause cancer. Actually, it protects against cancer. When you eat animal protein, it causes low-grade metabolic acidosis and leaches out your bone and increases the risk of cancer. It actually does study with milk. Countries that drink lots of milk have increased osteoporosis and fractures. So again, it's marketing. Just like alcohol was marketing and advertising, right, for the alcohol industrial complex. So the same thing with cow's milk. We are the only species that continue to drink milk after we weaned off of it. And we drink another species milk. That doesn't make any natural sense. Yes, when people went to Europe and they couldn't get the sunlight, they depended on the cow for the proteins and so on. If they didn't do that, they didn't have the mutation to digest the lactose, they would have died. So they were selected to have the mutation so they can continue to break down the milk. But we don't need milk to survive, it's not necessary. We have lots of land. You can get all calcium, vitamin D from the sunlight. You don't have to drink milk. Now we know with dairy products, you get lots of allergies, sinuses. Right? So, a whole plant-based diet, you kill, I shouldn't say kill, you save 10 birds with one nest. Not kill 10 birds with one, I don't like that metaphor. Because once you have a whole plant, it's a right relationship, it's organic. And it's a kind of meditation, it's a spiritual thing for you to grow your food and to cook your food and share it. Right? That's our daily bread. Technically, that's where it all starts from. Once you're in a right relationship with your food and your body and your family and your community and everybody working together, it's something called community-supported agriculture is big in Canada. Let's suppose we're a community that have 2 or 3 farmers. You don't think no government for it. They come together, bring some money so they can get the knowledge, the equipment, right? You can have an app, you get good technology so that, okay, and this person will drop. So they subsidize the farmers with the food, and they have others, okay, we want some tomatoes and so on. You get that subsidized price. So the farmers support the community supports the farmers support the community. And guess what?
The cycle.
If you spend in the economy, so instead of depending on foreign direct investment and imports, if you have domestic, local investment of the people
In the community.
So from the lockdown, making us spur innovation, entrepreneurship, development is the way to go. The multiplier effect. And we will see how we become much more healthier, we become together as a community. We put aside our tribalization, our polarization, and become one big family. Because COVID, right? For me, it made me change my life, and COVID should make us change our policies that are healthier, for us and for the next generation. Right? I don't want to scare you all, but for me, I realized COVID is a wake-up call, and I call this the COVID Passover. That's putting to rest our old ideas of what is important and what's not important. If you're not in the right relationship, you're going to be at risk. If you're in the right relationship with your body and the soil, it's going to pass over. So we're talking about biblical events happening today. And if you look at all societies that collapsed in the past, it was due to plagues and pestilence, right? So maybe it was coronavirus back then, coronavirus BC, that went through Egypt at that time. And my God said, Moses said, let my people go. He said, let my people go from unhealthy lifestyle, from being shackled to a system that puts profits off of people and planet. If we don't wake up and live our life that's wholesome, we're going to end up suffering for it. But if we live in the right relationship, then we will be protected by liberty. And
Aye.
we're asked to be parents, how is it? Because they're going to lead us to the promised land. We just have to listen. Okay? Any questions? More questions? Okay. Awesome. So you see, all I'm talking medicine, this is bigger than medicine. This is economics. This is politics. This is spirituality. There's a difference. A healthy lifestyle is a spiritual lifestyle. It's an economical lifestyle. It's giving you a voice. It's empowerment. So you can become a better person to flourish. So you can be of value, not only to yourself, it's only but to others. And this is such a legacy there. You invest in community. Don't put your money in the bank. Put the knowledge is power. The heart is power. And that's where it should come from. The heart, you feel it, you connect.
Do you see AMI? At the time, like at the junction, on increasing?
Yes. In the younger age groups too. Yeah. And even with COVID now, you're going to see more of that because of the stress of it. And we know that what causes the plaque to rupture is inflammation. And once you have this, what we call the cytokine storm, this hyperinflammation, it causes it to rupture more. So that's why those who have comorbid illnesses, like those over age 65 who smoke, obese, I mean, if you look at our nurses, I mean, I think 90% are obese. I was obese, so I empathize. If it was difficult for me who knew so much, with COVID scaring the hell out of me, imagine how hard it is for others who don't have the skills or the resources or time. But for me, I mean, I understand, I empathize. So although I can see what's going to happen, and that's why when the door is opening, I'm very scared. Because we have a sick population.
Yep.
And if we have community spread, 10 to 15% of our health force will go down. Unless we change our lifestyle here. And that's limited, because I have a problem. And it's going on. And the whole body blocks you from living it out.
Dr. Sahely, one of my thing would be, since and then, okay, the nurses are overworked. Barely have time for lunch, they don't get a break, they're under pressure. Wouldn't it be wise, maybe, I don't know if you're on the committee of whatever there, with the big ones to... Okay.
I'm blacklisted because sometimes ignorance is bliss.
Okay, they have a lot of waste spaces at the hospital. I think government will be glad to bring in treadmill, exercise machine, to encourage the nurses who don't have the time. In their spare time at work, they get an hour, half an hour to go behind and exercise, free their mind, come back, because they don't have the time. It's just like the factory workers. Now some of them doing 2 and 3 shifts.
So why is it you have people doing 2 and 3 shifts?
I am out now, but I never did.
Right, but why is it a lot of people feel that they have no other choice but to do extra?
Yeah. For more monies, more monies.
So what are we working hard for?
I don't know. DEATH, not the EBT, because you can't avoid the EBTs. It all depends on how you live.
So the question is, okay, I agree. So here's the thing. You get more time for yourself, that's less time for work. So what about your colleagues? They're going to have to... No, I agree. The solution is your value system.
Yes.
Right. So what if, instead of you working like 8 hours, you only work 4 hours a day? You get more pay. But you have more nurses at work. So you work for doubles, your time you work halves, and you get the same pay or more. So you have the time to look out for your health. So you become less of a burden. In the long term, less sickness, less loss of work, less disability, less social security. So in the long term, it's feasible and can be done. In the short term, you have to have more people working to take up the slack. And if you have the same, because if you cut your people by half, they make it more stressful for you. Right? So if you look at what's happening in the world, so people are trying to solve this problem globally, or economic growth. A lot of politicians are under pressure to grow the economy. But by growing the economy, they make people work longer times. It's like
Enslaved.
Right, it's called debt slavery.
Yes.
Student loans,
Yes.
right? I mean, home mortgage, that's what people need to treat. I see people 65 years working still, and so why are you working? Their mortgage to pay. People may start late. So a lot of the time we call this debt slavery, people doing easy stuff, when you should be So the problem is, the solution is degrowth. You have more time to take care of yourself and your family, to cook healthy and exercise, but you have a living wage. So you have more employment. You have more people working, less stress at work, more kind of healthy environment. And guess what? Your workers are happy, your patients satisfied, you get good outcomes, government look good. So it's a win-win-win situation for everybody. The question is political will. Who's here and they're listening to?
No one but themselves.
I see a conflict of interest. Do politicians have vested interest in high-tech technology? There's no money to be made in prevention.
Nah.
So when I have my students, I tell them my job is to put myself and you out to business. Because if I do my job correctly and give you the right information to prevent your hypertension, your diabetes, your obesity, and you don't need bypass surgery, stenting, dialysis, knee replacement, and so on, then I'm putting other people
Out of business.
out of business. So you have to prescribe less medication because you don't need it. Exercise is the best medicine. When you exercise, what you do is sweat. That's your water tablet. You get this on your system. You slow your heart rate. That's your attenuated markers, right? You dilate because of the nitric oxide that allows you to rise to the occasion. When the occasion rises, decrease the blood flow to your muscles. You resist bone. That's your natural calcium channel blockers. You have amlodipine and so on, right? And you protect your heart and your kidneys. That's your lisinopril and so on. So just an exercise with greens and sunlight. You get everything for free. Take it, sun, sea, you swim, you get fresh air. Not only protects you against COVID, it protects you against heart disease. But guess what? You're going to put people out of job. You're going to need less doctors, less beds, less hospital to build, less MRI, less CAT scan, less dialysis machine. And again, there's a fundamental conflict between what's good for health and what's good for business. Until we align our business practices that facilitates health from a prevention point of view to save wasted lives. Right? So I keep telling people, I don't want to be seen as a health mechanic, waiting for you to fall off the patch up,
see myself as a health coach. So I give you the information to lead a healthy life. Sometimes in my doc, you're fighting against us, you're not doing what's in our business. This can't be sustainable. I don't want to be rich. I just want to be contented, make sure I can send my kids to school, I can buy healthy food, I don't have to kill myself working and die from stress. How can this work? Well, education comes with your annual physical every year. I remember $100, $120. You come every once a year, right? So you invest in my practice, and I invest in your health. So by actually mutually beneficial. So I am your health coach. You come, I said, if you cholesterol, you put on the weight, sugars, and like, okay, this is what we can do. Let's avoid this food, come off the fish, and you get your numbers, you know your numbers, and you feel good. Your mind open up, you'll be able to think better, move better, love better, and so on. And you live a fruitful, healthy life. So you invest in me, I invest in you, I have you, you have. Right? A lot of my colleagues not like that. But some of them require the surgery, the dialysis, the MRI, the CAT scan, to the business. And if you have a stroke or a tumor, no need for CAT scan, right? No need for bypass if you can prevent it and naturally die.
That is why I don't.
So CAT labs, you're an interventional cardiologist. We resign you to the dustbins of history, you become part of a museum. Those old days, there used to be bees and they used to put these, the plastic surgery on the arteries to open it up, and so on. So again, we need to change, have a higher consciousness, right relationship with our bodies and the universe. That's love. And if you more love yourself, if you more love God, you know everything more happy yourself. So I hope I'm not making you feel depressed.
Nice, real.
It's within our control, we can change it to better. You just need to listen more to your answers. What are you laughing, boss? Okay, I'll give you some insight. Okay? I'm Christian, I'm happy. Okay? What's the Holy Trinity? For Christian, Father, Son, and Holy Ghost. Why is it when we pray we say, our Father? Shouldn't it be our Mother? Who feeds us? Isn't it Mother Earth? No, the Father is the Son. That's the light trees. That's the sperms that fertilize the soil. So we have Father, Son, Mother Earth. Okay? So what's the Holy Trinity for the Rastafarians? Mother, Father, Child. The building block, the Empress. And that's some fake Rastas who disrespect the Empresses, but that's the building block of society, not man, man, man. Right? Father, Son, Child, so the next generation. Okay? So once we get that right relationship, not we call it a patriarchal, man-dominant system, it's a family-centered. So patient-focused, family-centered, community-supported, nation legislated, as you say. Right? So I keep saying, if we look back at history, most of the problems are man-made. But they can only be woman-based. Most of the carers around us are ladies, and so on. So, if we start to think like grandmothers, who care for everybody despite the children being of different personalities, then we can become more all-inclusive and willing to lead each other. Okay? So, new consciousness. There's divinity in each one of us. I am because we are Ubuntu. So if you look at all the indigenous religions, they all come down to the same thing. No, but it takes a village to raise a child. You have to have community there. It also takes a village to spoil a child too. Okay. Any other questions, concerns? Okay, if no more questions, thank you. And so, I've infected your mind with the seed of healthy living, trying to preach the gospel of healthy living. So you're going to be my evangelist. Go out on the roads, the byways, and preach the good news.
Spread the word.
Spread the word. Thanks again.
Dr. Sahely, on behalf of Care Nursing Agency, which is Kisha Boys, and family and colleagues, we're here to say thanks, to present this food as you live it.
Thank you.
And we were really impressed with your communication that was expounded on today.
Thank you very much. Social business.
Yes.